Well, thank you guys for coming. Like I told you before, that we're videotaping this for purpose of the certification. We call this talk the 30 minutes to better health, but it's really like a 20-minute talk, and then we open up for 10 minutes for questions. And the reason I do this is because so many people have a misperception about chiropractic care that it gives us an opportunity to explain a little bit is what we do, and that way you can see us and decide like, do I like this office, and who are they, and learn a little bit about us. So we say it's health because chiropractic is all about health. Most people think it's about back pain. A lot of people think, oh, you go to a chiropractor when you have back pain. Why would you go when you have an ear infection or stomach ache or asthma or something like that? And that's what I'm going to kind of try to explain over the next 20 minutes or so. But most of the patients who come into our office are really here for wellness care. They may come in for some kind of aches and pain, but then as they get better and they start learning about how chiropractic care can contribute to health, it turns into what's called as wellness care prevention care. So we're going to chit-chat a little bit with that. Chiropractic care is really not the treatment of disease or pain. It's all about reducing interference in the nervous system, and that's how it contributes to better health. The body has an amazing ability to heal and regulate and do what it's supposed to be doing if everything is functioning fine. So if you're reducing that pressure and that interference in the nervous system, the body's going to do what instinctively it's supposed to do. So I'm going to kind of explain that, and so you'll understand why getting adjusted can actually increase your quality of life and increase your overall health. So I would say we have to go back to the early stages. So we got a little baby here, back to the embryonic stage. The brain and spinal cord are the first thing to develop when a woman is pregnant. So most women don't even know they're pregnant. So they're 4-6 weeks pregnant, and the first thing that develops is the brain and the spinal cord, because that's what's responsible for making the entire baby. I mean, if you think about it, the mother doesn't have to sit there. You don't have to sit there and be like, I take this pill for the baby's legs, and I'm taking this pill to form the baby's heart, and I'm taking this pill to form the baby's, intestines. It happens automatically, and it's pretty amazing. It's called the innate intelligence. So it's that true miracle. So for those of you who've had kids, you know that like all of a sudden this baby is created. So there's no scientific, medication or pill that's going to create that baby. It's the body's own ability. And so that tells you how important that spinal cord is when it's the first thing to develop. Does that sort of make some sense? So it's the first thing that develops, and it's really, really critical to make sure that the brain and the spinal cord are working as efficiently as possible. Now, the same intelligence that creates the little baby and creates you when you're in your mother's baby, that same intelligence stays with a person their entire life. So for breastfeeding, for your heart beating, for your stomach digestion, for breathing, all of these things happen automatically without you guys even thinking about it. Okay, so you're sitting here, your heart is beating, hopefully, right? Your lungs are working, your kidneys, your intestines, all of these things are happening, and you don't have to think about it. You don't have to tell your body what to do. It just happens automatically, right? And how many of us take that for granted, right? It's gonna work. But when the breakdown happens is when there's some kind of miscommunication, some kind of problem between the brain and the spinal cord, which will cause those body parts not to work and not to work as efficiently as possible. Well, the thing I want you to know is that that intelligence that creates the baby is what keeps your body alive. And a lot of times people forget that. We come out of the womb and we're like, I'm gonna take all these medications to let the baby get better and to take care of the toddler and to take care of the headaches of an adult or whatever medication it is. And while medicine is a lot of times very necessary, a lot of times it's just covering up the symptoms of the body not functioning efficiently. So that intelligent, you have to learn to trust your body and that your body has ability to heal. Like I said, we're always afraid. We don't think that the body can do it, and we get afraid that our body doesn't know what to do, when in fact it really truly does. So the brain and the spinal cord is what makes everything happen. I'm going to kind of explain that a little bit. So if there's a problem in how the body and the brain and body are communicating, what do you think is going to happen? Not good things, right? It's kind of like you're on a cell phone. I mean, everybody has cell phones these days. You're talking to someone and all of a sudden you hear the crackling. You can't really talk to that person because it's a bad connection. If there's a bad connection on that cell phone, you're not going to really be able to hear what the other person is saying. The same thing can happen if there's a bad connection between the brain and the spinal cord and your body parts. Your body is not going to be able to respond and not do what it's supposed to be doing. So it really comes down to structure and function. The bones of the pelvis and the bones of the spine are what actually protect the spinal cord. So the brain is up here, right? Turns into the brainstem, comes down the spine, and has little nerves that go off to every single part of the body. So people think we're back doctors because we're working with the back, but we're really working with those nerves. The nerves are protected by the spinal, or by the bones of the spinal column are protecting the spinal cord, and that's why we work on people's backs. So it's not anything to do with back pain as it is to do with the nervous system. So that nervous system is a communication system between the brain and the rest of the body. Everything, messages go down from the brain, down the spinal cord, out to every single organ, tissue, cell within your body, and then those messages go back up to the brain. All day long, back and forth, and that's what makes your body. Any kind of disconnection in that is what's going to allow your body to have some kind of symptom. Sometimes the symptoms are silent, like you may not necessarily have pain, you may not necessarily have digestive issues, you may not necessarily have heart issues, whatever it may be, but a lot of times this is what people this is what the body is focusing on, making sure that communication process is working. But if there's that breakdown, that's when problems can start happening. So chiropractors, we're focusing on the nervous system. So that's one of the biggest things I want you guys to really understand, is that it's not so much about pain as it is about nervous system. Any kind of interference, any kind of blockage in that nervous system is called a subluxation. So that's a fancy chiropractic word to say that that vertebra, that bone in the spine, it's either misaligned or it's not moving properly. So we can bend and twist and do all these different things. Our body is supposed to be doing that. But when you have that blockage in that spinal cord, obstruction, pinched nerve, whatever you want to say it, it's going to interfere with how your body is functioning. So subluxation is a word. If you come in here and get adjusted, you'll hear us throwing it around every now and then. We'll talk about subluxations and how that can attribute to a person's quality of life and how that can cause different aches and pains. So you go to a chiropractor, we're looking for subluxations. It's that interference that's not allowing the body to work well. The vertebra gets stuck, they don't move the way they should, or they get stuck in one position and don't move back. You lose that normal range of motion. A lot of times people say it can be pinching a nerve. Yes, it absolutely can be pinching a nerve, but sometimes it doesn't have to be really pinching a nerve to end up with that subluxation. So subluxations are not always noticeable. Sometimes people say, well, how do you know a baby needs to get adjusted? Or how do you know, like, I don't have any pain, I'm not subluxated, do I need to get adjusted? Well, subluxations can be from physical, emotional, and chemical issues. Physical is what typically brings most people into the office. You know, they've got some kind of pain, they were in a car accident, they, you know, fell down, or, you know, skiing, water skiing, you know, being at a Disney ride or something like that. That's what most people associate subluxations with. But there can also be that emotional component, stress. You know, you're tight, you're always, you know, stressing yourself out, having a lot of negative thoughts, causing some of those problems. And it also can be a chemical subluxation, which is the toxins in our environment, and the toxins in the foods that we eat, and the Roundup that's on, you know, a lot of the grasses and weeds around here. All those different toxins can affect our nervous system and affect our body's ability to be healthy. So one of the first things that can actually cause a subluxation is the birth process. Again, sometimes people say, oh, it's car accidents, but it's really that birth process. So the baby is inside mom and being pulled out of the birth canal, or even through a C-section, pulled out from the belly, womb. That can be very stressful. I mean, if you think about it, when a baby is first born, you're like holding the baby really gently, you're holding the head, you don't want to do anything. Yet babies can be pulled out of the birth canal, and that can cause immediate subluxation to the upper part of their neck. So if everybody takes your finger, a little class participation here, and just gently put it on your eyeball and close your eye, or excuse me, your eyelid, that's about 3 to 6 ounces of pressure. That's the amount of pressure that we use when we're adjusting newborns. Okay, so we're not getting in there going crack, crack. You know, a lot of people think, oh, why would you adjust a baby? You're going to do the same thing to a baby as you do to an adult, but it's very, very different. So that birth process is the absolute first thing that can happen, and that's how gentle that subluxation or that adjustment is. So as long as you're on the correct side and you're doing it the correct way and you know what you're doing, which we do, it can make a huge difference in the quality of life for that baby and improving that baby's ability to respond and adapt to life as they grow older, because the nervous system, again, is what controls everything. So if you're allowing that adaptation to improve, the body's going to get better. Then we have falls. We always ask new patients, you know, have you ever had any falls? And they're like, no. I'm like, really? You've never fallen in your entire life? If you ever have little kids, you see a toddler, you know, someone learning to walk, they're falling down 20 times a day, 50 times a day, whatever it is. And then they go outside and they, you know, on swings and all these different things, falling all the time. And a lot of people just ignore it. I mean, most people do because they're little kids, they're not falling very far, but you know what, proportionally they're falling just as much as far as you and I are. So if you guys were to fall, 20 times a day, how would you feel? You think your body would get subluxated? All right, so that can happen to little kids. People have falls all the time. You could be an adult and you can be skiing and you can be falling. You can walk down the stairs and have a little slip and fall. So falls are one of the more common ways that people can get subluxated. Repetitive motions, sitting on computers all day, sitting on phones, texting. These are some of the different things that can cause subluxation. So it's not always an obvious one, but most of the time it's a lifelong process that's been happening. So that by the time that people come to our office, they've had subluxations have been there for their whole life. And then, like I said before, the toxins of the environment, the emotions. So it's not just a physical subluxation. There's so many other things that can contribute to those problems. So chiropractic adjustments, what we do is we're going out there, we're trying to correct your subluxations, okay? Again, that's that misalignment in the vertebra. It's tailored to the individual because we're not doing the same thing to everybody. Some people need what's called side posture. Some people have a drop table. Some people, we use the activator, which is that little clicky thing. There's different things and every person gets generally whatever they need, and it's very specific to that individual. We say it's gentle, like I told you, that 3 to 6 ounces of pressure is very specific. So we're not getting in there and adjusting 23 of the 24 vertebrae, we're getting what your body needs. And sometimes people come in here and I'm like, okay, your upper neck is fine, we're not gonna do that. And they're like, you're not. And we're like, no, you only get the adjustment, whatever, if your body needs it. And also it takes time. It doesn't necessarily take time to adjust somebody, but it takes time for the body to heal, especially if it's been there for 30, 40 years. That's, I would say, the biggest thing when people say they don't get results is because they're not coming in the frequency that they should. They didn't listen to the chiropractor, they didn't do what they were supposed to be doing, or they didn't give it enough time. They're expecting results in a matter of days or weeks, whatever it is, and it can take a lot longer than that. So the adjustments are done to correct obstructions to the nervous system, and again, it takes time for the body to heal. You remove that obstruction and the body's ability to heal improves. So you live your life through your nervous system, right? How long do you want your nervous system to work well? Do you want it to work well for just a few days, a few hours, a few weeks? So I love this quote where he said, how important is that your nervous system is functioning optimally as often as possible from this day forward through the rest of your life? And that's where, in a sense, lifelong chiropractic care comes in, because it's like, why would you want to get everything working well and then just stop and leave it alone? And the same thing applies to like cutting your hair. Can you imagine if you cut your hair like once and never cut it again, or your fingernails, or you ate really well for a month or two and got on a really good diet and then just gave it all up? Your body would go back. It's all about maintaining and working on keeping your body as functioning as well as possible, hopefully for the rest of your life, because that nervous system is what's going to keep your body working well. So I say take care of your nervous system. Get checked, get adjusted. People get great results with chiropractic care. Eat healthy, nourishing foods. Your body's pretty amazing. It can take French fries and make new blood cells, and it can take French fries and cookies, and it can make new skin cells. But the healthier foods you're eating, the more nourishing foods you're eating, your body's going to better ability to create a new body. I mean, technically you get a new body every 7 years by replacing bones, replacing organs, all those cells. So you can eat really healthy and may not notice a change right away because it takes time for all of that to change. But the nourishing foods are what's also going to be very, very important for your body to be healthy, especially nowadays. There's so many pesticides out there that are on our foods, and processed foods and hormones and things like that. Nourishing foods are going to be really important. Getting plenty of sleep. New moms, I know it's hard and you're getting not that much sleep and stress, but sleep is when your body repairs. It's when it heals. So if you're someone who's getting by, I can get by with 4 or 5 hours of sleep every night. Yeah, you may be able to get by with that. Your body's used to it, but over time, that's when problems can start happening. So sleep is a really important component. Ideally going to bed around the same time every night, getting up around the same time in the morning. Getting exercise, that's really important, okay? I know that the people who tend to move more are in less discomfort and better off than the people who are sitting at a desk all day. I know I personally have a pretty bad low back, and thank God I'm adjusting all day, because I know if I was sitting at a desk all day, my back would honestly be really bad. So the exercise is really important, getting up and moving. If you are at a desk job, get up and move as much as you possible. Do some kind of exercise, walking, yoga, swimming, tennis, whatever it is you like. Don't do something just because you you heard it's really good. Find something that you like and stick with it. And I always say, try to make it a habit, because it's really hard to start exercising when you're older because you've never done it. So that's try to do it when you guys here are younger, and build it into your lifestyle. And a positive mental attitude is also really important when it comes to health. If you're someone who's really negative all the time, then you tend to get slower results. Things aren't working as well. So having that positive attitude, prayer, meditation, whatever it is, can really help your body heal as well. This is a study that came out years ago where it said they looked at people who were under chiropractic care for years. Said 71% were taking less medication, 87% an improvement in overall health, 92% living a healthier lifestyle, 98% a physical problem improvement, and 99% a decrease in physical pain. And that's pretty amazing. I mean, yes, the pain part, but improvement in overall health and living a healthier lifestyle, 92%. And that's from getting your body working better and learning some of these strategies and learning what it takes to get your body working better. So that's pretty amazing. You're not going to see those kind of results through, orthopedics or anything like that. Success stories, we've had pregnancy, people who are coming in with breech babies. Generally, people who are pregnant have much shorter labors if they're under chiropractic care regularly throughout their pregnancy. Newborns, breastfeeding, colic, torticollis, those are some of the great results that we've had with little kids. Toddlers, ear infections, developmental issues, if they're late to crawling, if they're late in walking, things like that. So these are not like their symptoms, but these are just some of the things that we've had great results with working with kids. Athletes, getting athletes to perform better, to not be injured, and to get over injuries faster. Animals, I am certified in animal chiropractic. There's not a lot of chiropractors in this area who are. And we get really cool results seeing animals. We see them downstairs. But animals can benefit from chiropractic care as well because they have a spine and they also have a nervous system. So the biggest thing I always say is, it's not about treating these symptoms, it's about taking care of your body so your body can work better, taking care of your body so your body can heal better. So in winding up, I want you to understand that it's really all about the nervous system. It's really all about your body's ability to heal and regulate and function well. And so, have you had your nervous system checked? Hopefully some of you guys will start doing that. Do you have friends? Do you have neighbors? Do you have spouses or anything like that? Are they under chiropractic care? So once you start seeing the results and you start getting better, don't keep it a secret. I mean, most people, it's amazing. It happens all the time. People don't talk about things they like. They'll complain about things they don't like all the time. But, people will come in and be like, oh, I never knew you adjusted so-and-so because that person was just staying quiet, for whatever reason. So tell one person, and hopefully that person will tell someone else. And if this office is not the efficient office for you, there's other offices around. There's a lot of chiropractors around. So much of it depends on the personality and the technique of the chiropractor, the location, different things like that. But if chiropractic, you talk to someone and they say, oh, it didn't work, probably because that person wasn't going in as much as they should have been going in. They weren't following the doctor's recommendations, or it was a different style and a technique that the person didn't like. So that's why we always talk to people and be like, okay, what did they do? What did they not do? And hopefully our adjustments will be the one for you. And if not, we can help you find a chiropractor who is. But the biggest thing is finding a chiropractor, getting yourself checked and adjusted, and allowing your nervous system to work as efficiently as possible, because that's going to allow your body to be as healthy as possible. So, make some sense? All right. You guys have any questions? No questions. All right. Well, we will. We're going to stick around. I know sometimes one of you guys wanted to talk to us, so we'll ask specific questions afterwards. But thank you for coming. Appreciate it.